An increase in sexually transmitted infections across the country during the pandemic. One of the reasons, the lack of access to testing. Health departments are now pushing people to get tested, as the longer you wait to do so, the higher the risk for serious consequences.
Many of the clinics and other healthcare sites that were providing testing, that provide STI testing, were doing a lot less of it during the pandemic.
The executive director of Sex Information and Education Council of Canada, Alex McKay, says there are a number of obstacles that stop people from getting tested in general, including the stigma attached to STIs, among other reasons.
They assume it's not going to happen to them. Secondly, that the vast majority of cases of sexually transmitted infection are transmitted asymptomatically. And the person who develops the infection is asymptomatic as well.
The pandemic was also a time when health officials were encouraging people to stay home, but not everyone was listening.
People were still having sex. People were still connecting with people outside their households in order to have sex. Maybe they were doing that in different ways than they might have before the pandemic set in. We really need to redouble our efforts, I think, to promote sexual health promotion generally by the public health community, and we have to ensure that access to STI testing is restored and that people are encouraged to access it.
We reached out to Toronto Public Health regarding this concern, and here's what they said. In part, as TPH staff return from COVID response and immunization clinic work, TPH is ramping up to our normal level of sexual health services over the next months. These include additional sexual health clinics, awareness campaigns that promote healthy sexuality, condom use, and STI testing, workshops on sexual health and STIs. Further adding, it's important to seek STI testing if you have symptoms like a rash, bumps, sores in the genital or anal area, an unusual discharge from the penis or vagina, painful urination, or pain during sex. After unprotected sex with a new partner is another good time to seek STI testing.
And the more time goes on with an undiagnosed infection, the greater the chance that you're making yourself vulnerable to sometimes very serious health consequences, which can range from infertility all the way up increasingly to different forms of cancer.
Current Canadian guidelines recommend yearly STI testing for anyone who is sexually active and is under the age of 30 as part of their routine health care. An important reminder to also practice safe sex. For City News, I'm Maleeha Sheikh.